Cuyahoga County and Cleveland. Why are we such a big chunk of these?
Thank you for your patience as we try to practice social distancing and awkwardly pass each other as we move to the podium. So the question is, why are there so many more cases in the Northeast Ohio region, Cuyahoga and Cleveland specifically, as compared with the rest of the state, when you look at our state numbers that are publicly reported as of this morning? And that is partly because we have had the most testing capacity of anywhere in the state. So our hospital partners really stepped up to the plate and very quickly coordinated with a business that works with the CDC to get the right reagents and supplies to do testing here. And so in the state of Ohio, the first few hospitals to go up and running with in-house testing were here in our community. The two hospitals that we've been talking about, University Hospitals and Cleveland Clinic and now Metro Health, very quickly came on board with testing. Therefore, we were able to test far more people in our community initially than anywhere else in the state. And so when you have increased testing capacity, you will find increased cases. But that doesn't necessarily mean there aren't other cases in a similar prevalence in other parts of the state. Again, just reminding folks, even though we have more testing capacity here, it is still not sufficient for a community testing strategy. So we're really trying to make sure that we're thoughtful about this, but that is one of the main reasons that you see more tests here positive.
Are there any rough estimates how many cases could be in this area, just undiagnosed?
That's a tough call. We are being very careful and very conservative here around how we identify cases. So my team, our team, is working really carefully with anyone who could have been exposed and who has developed symptoms to give them isolation recommendations and then to also follow their contacts, even though they may not have lab confirmation of the infection. So I cannot give you numbers because that is something that's very difficult to do, but we do know there's a lot of symptomatology or symptoms happening in people, and so we're treating them as if they probably have this. But again, remember, influenza is also really common right now. This is a late and significant level of influenza in our community. And this particular influenza is happening also in people who had the vaccine. So we know that that's also an issue for us. But that does not mean that we don't feel vaccines are great. So please remember next season to get your annual flu vaccine. That's still really important. But we do know we've had a spike in influenza late. And so that's also part of some of the symptoms people are having right now.
We're going to take one more question, please.